talking about what is mindful eating and paying attention to your body cues. How do you know when you're full? How can you stop before you're stuffed? It takes sometimes up to 20 minutes for your brain to realize that you've been eating and then you're starting to feel full. And so how do you approach mindful eating? Also looking at meal planning and portion sizes and label reading, all those kinds of things. And then physical activity is a really important component of the whole Mediterranean style of living. And so the med instead of meds isn't just about eating, it's about lifestyle. So we incorporate that as well.
This year's Walk Kansas, a K-State Research and Extension Health and Nutrition program that helps participants improve their physical and mental health, includes a 6-week virtual learning series focused on the Mediterranean-style eating pattern. Extension Family and Consumer Science Specialist for the Northeast region and state leader for Walk Kansas, Sharolyn Jackson, says this is being done as a pilot before rolling it out to a larger audience. On today's Sound Living, Med Instead of Meds. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Jackson says the Med Instead of Meds program features many of the nutritional principles and recommendations that Walk Kansas has been promoting for years. Sharolyn, as part of Walk Kansas, you're looking at Med Instead of Meds as really kind of an educational curriculum part.
Yes, this year we've been offering weekly webinars through the middle 6 weeks of the program with the Med Instead of Meds curriculum. Just mention and give credit to North Carolina State University Extension. The curriculum's written and developed by Dr. Carolyn Dunn there, and so we've purchased that curriculum for our agents to utilize across the state. And it's a series that looks at how we can prevent and control chronic diseases and promote overall health by this particular eating style, which really focuses on using pans instead of pills to improve our health.
The takeaway message here is the fact that it does help overall health.
Yes, it's one of the most important things to know is that up to 2/3 of chronic diseases like diabetes, heart disease can be prevented by lifestyle changes and specifically diet and exercise. And research has shown the connection between lifestyle and chronic disease for quite some time. And it's provided an insight into some of the ways to move people to the right direction for making lifestyle changes that can decrease this risk. However, though, we still see the number of people with chronic diseases rising, and that's concerning. So we feel like we know, we can advise people, but it's really about how do we motivate them to make those changes.
And this Mediterranean eating style is really similar to a lot of the things that we've been talking about for years through Extension.
It really is. It's not a diet. None of these are a diet. There are different eating styles that are all healthy. There's not just one way to eat healthfully. And so we do look at this Mediterranean eating style and get into that in a little bit about what that really is. But there are a lot of reasons why, people feel kind of stuck when it comes to healthy eating. They think that healthy eating's too hard or it's too confusing, a lot of mixed messages coming out from all different places. And then they have this idea that it's too expensive. And some common reasons why people don't eat more healthfully, they think it doesn't taste good, it's not delicious. And a lot of times people make their decisions based on taste. Or they, again, don't have enough time, don't have time to prepare foods or even plan for what they're going to eat. And they have limited cooking skills. And right now, culinary literacy is at an all-time low. So that's all wrapped into this curriculum, and what we're trying to do is help people feel more empowered to take better control of their family food habits.
It's kind of interesting because we see so many things online now about how you can cook this, that, and the other thing. And people like to watch those, but like you say, trying to actually put it in practice is sometimes more difficult. And also just the fact that people don't necessarily like to change what they've been doing for a long time.
Right.
You like certain foods and you kind of go back to those.
And we're kind of hesitant about trying something new or a new combination of flavors because we've not had that before. And so we're really trying to encourage through this curriculum the best way to offer it. And, of course, when we do a webinar series, we can't give you the tasting aspect. We can just talk about the recipes and try to really motivate people to give them a try. But the best way is if you can actually be there in person and prepare and taste the recipes.
And smell.
And smell, yes. And see, because the Mediterranean way of eating is very colorful. and very inviting.
I'm not sure how the curriculum is set up, but I know we often hear about those 7 steps to the Mediterranean way.
That's right. There are 7 simple steps, and that's the core principle of the curriculum. The first one that we talk about after a good introduction into what the Medway really is, what it means, is to change your protein. That's the one that maybe is concerning to some people. They wonder, well, can beef fit into the Mediterranean way of eating? And it certainly can. It's just perhaps the portion size and the frequency of eating beef that might change. And so you want to replace some of the meat in your diet with plant proteins as well and make those in combination. So maybe beef might become the flavoring part of the recipe and not maybe the main part of it. You think of like a stir fry. You can get the flavor of beef or other meats and have lots of vegetables in there and whole grains to go along with that, but you're not eating a piece of meat that covers half of your plate. That's what we're moving away from. And so we're also promoting eating fish and seafood at least 2 to 3 times per week, and also white meat poultry, turkey or chicken, limiting red meat. And when you do have red meat, choose the lean cuts, and then greatly limit or even eliminate processed meats. So that's the first one. The second is to swap your fats. And so we talk a lot about olive oil, but there are other healthy fats as well. So you're replacing solid fats such as butter, margarine, with olive oil or canola oil. So it's not that we have to eliminate fat, but we're just choosing a different one. We're wanting to limit the saturated fats, and if we can, eliminate trans fats. And then we're eating more vegetables and more fruits, definitely. It's really a focus on those as kind of the nutrition stars. So you need to get at least 3 cups of vegetables per day and in a variety of colors. And particularly when you're choosing like green leafy vegetables, go with the dark green ones. Iceberg lettuce is one that's probably the most popular, but yet it's the least nutritious of those greens. So you want to go with the dark leafy greens. 3 cups of those per day, and then 2 cups of fruits per day. And this is what we've been promoting in Watt, Kansas for all the years I've been involved, is to increase that fruit and vegetable consumption. So really, we've been promoting the Medway of eating. Again, with the fruits, you'll choose a variety of colors and to include berries often. Berries are mentioned specifically as fruits to include.
They have a lot of benefits, don't they, from a physical standpoint?
They have a lot of nutritional benefit. Any types of berries, and we talked about the MIND diet also as being a focus, a combination of the Mediterranean eating style and also the DASH diet, which is focused on lowering the sodium content for heart health. Berries are mentioned specifically there because of their nutritional profile.
The nice thing, too, is right now a lot of that is very much in season.
It is. It's going to be in season even more here coming the next months. But we're really lucky in that we can get a lot of these foods year-round. And to save on your budget, you'll want to be cautious of when you buy those. But this is the time of year to start enjoying lots and lots of fruits and vegetables. Another one of the steps is to snack on nuts and seeds. And you choose at least 3 ounces, which would be 3 small handfuls. And I encourage you to measure out, what does that look like? And this would be per week, 3 ounces of nuts and seeds per week. Again, those are packed with calories, so you need to be mindful of keeping that within your calorie budget. And go with the low salt or the non-salt varieties. Avoid the honey roasted ones, heavily salted ones. Nuts and seeds are an important part of the Mediterranean eating style. And then another is to make your grains whole. We've given the advice to make at least half your grains whole. We go a little bit more toward that whole recommendation with the Mediterranean eating style. Eat grains as grains and choose whole grains like oatmeal, quinoa, brown rice, popcorn is a whole grain. Again, don't put a lot of butter or salt flavor on it, but you can enjoy popcorn. It's a whole grain. Look for whole as the first ingredient on the ingredient list when you buy products in the store. And then the 7th step is to rethink your sweets. The Mediterranean eating style is low in sugar, and so limit your sugar intake. Have no more than 3 servings per week of high sugar foods and drinks. So that is one thing that I think is going to be a challenge for many people, is to limit the sweets and the desserts and beverages and so forth.
It's kind of the American way, isn't it? In a sense, we often top off a meal with something sweet.
And if you can start to move yourself to think of fruit as being that sweet treat at the end of the meal, that's really helpful. Or cutting down the portion sizes of those. And it doesn't need to be a very abrupt change, but kind of move yourself slowly away from the higher sugar options. It can be a way to feel like you're not being as deprived and work toward making it a habit.
Is that one of the things we sometimes struggle with is we try to go almost cold turkey sometimes with things, and that never works. You really do have to reduce this kind of gradually to where you don't necessarily crave that sugar.
Right. I think particularly for things like sugar, it's helpful in that you get used to then what, in sugar and salt as well, you become acquired to like things really salty. And then when you reduce salt and you go to maybe a restaurant where they've salted, I notice this sometimes with mashed potatoes because I really don't put much salt in mashed potatoes. And you go to a restaurant and they're so salty you can hardly eat them. And so you develop a different taste expectation, and the same with sugar. So you do that gradually and adjust to a lower level and then start to cut the sugar back a little further and adjust to that level and to where it's what you expect.
And through these recipes, I assume they're also learning that there are ways to use herbs and spices instead of salt?
Exactly. So they're very flavorful in their combinations. So it's using a lot of those herbs and spices to take place of the salt, giving them a lot of flavor and interest that way. And I'll just say be open-minded when you start to experience these different flavor profiles, because if you're expecting everything to taste salty, it's not going to be that way. And if you don't like it the first time, give it a try again and a third time and see if you might grow accustomed to it and give it a chance. The Medway is really based on how people historically ate in the Mediterranean region. It's not necessarily reflective of how people currently eat. So it's not necessarily a modern Mediterranean flavor profile in the Medway. And so there are lots of different flavor profiles that you can give to the Medway of eating. It can be Italian, Greek, Indian, Mexican, or just plain delicious, whatever you like. It's not about necessarily what we associate as the flavor profile of the Mediterranean. You can add your own flavor profile to it.
One thing we should probably add is the fact that this has been proven to be a very healthful diet based on just longevity.
Right. We talked about the blue zones before where people live predominantly longer and healthier lives, and many of those are in the Mediterranean region, and they're eating this way, have for years and years and years. And so there's a lot of true research as well as just observation that you can lend to the Mediterranean style of eating. I also want to highlight that in this curriculum each week, we talk about the simple steps that I just went through, but there's also a mindfulness component to the curriculum. So each week, talking about what is mindful eating and paying attention to your body cues. How do you know when you're full? How can you stop before you're stuffed? It takes sometimes up to 20 minutes for your brain to realize that you've been eating and then you're starting to feel full. And so how do you approach mindful eating? Also looking at meal planning and portion sizes and label reading, all those kinds of things. And then physical activity is a really important component of the whole Mediterranean style of living. And so the med instead of meds isn't just about eating, it's about lifestyle. So we incorporate that as well.
Yeah, being mindful and then developing that as a lifestyle is really what we're going for. And it sounds like through this curriculum, there's a good opportunity to make those changes over time.
Mm-hmm. It is a 6-week curriculum, and that's how it's divided. If this program is offered in your local community, it may not be the full 6 weeks. Maybe they'll combine some of these into a shorter time frame just to be mindful of people's time that they have to devote to it. But it is something that we introduce in smaller doses, each concept, so that you have time to apply it and actually think about it.
Is this something that we anticipate will be a hybrid or something it may be one or the other? It may be online or it may be in person?
Yes. We're right now experimenting with the virtual delivery through the webinars with Watt Kansas. And there's a possibility we'll have more online and virtual options as well as in-person options for getting this information out. It's very new in our system, and so I'm just wanting to make people aware of it, to contact your local extension office, see if they have plans to offer med instead of meds, to know that it's available, and hopefully we'll be able to share more of this information with the people of Kansas. I also want to highlight that, as you mentioned, that this is similar to what we've been recommending in Watt Kansas for years and years. On the website, wattkansas.org, there are newsletters posted from the past 10 years of the program, and so there are a lot of this information is covered in those newsletters. Each week is a recipe, and these all fit into the Mediterranean way of eating, into that eating style. So if you're wanting to look there to get some ideas and get started. Also, there is a website for med instead of meds. It's just simply medinsteadofmeds.com. The recipes are all there. The educational content that we provide in the sessions is really not on the website, but the recipes are. So you can take a look at those and just see what it's all about.
That's K-State Research and Extension Family and Consumer Science Specialist for the Northeast region and State Leader of Walk Kansas, Sharolyn Jackson, with information on the Mediterranean style of eating. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.